gynae for the step 2 CK, we're going to come into the breast. So we can see palpable breast mass. So if the woman is less than 30, we would just do an ultrasound followed by a mammography if we see any abnormalities. So if it's an ultrasound, what are the two main things? We can look into a simple cyst or a complex cyst. Simple cyst, we can just leave it or drainage, needle aspiration. Complex cyst will require a bit more, so we need maybe do a image guided core needle core biopsy of this cyst over here. We can also have over here anyone above 30, we can then go for mammo, then ultrasound. So this is going to be suspicion of mass, and we can go for a biopsy. So we can see the diagnosis of palpable breast mass can be confirmed by biopsy. So ultrasound in a woman less than 35, this is according to NBME. So we can do ultrasound even in a woman less than 35 if this is NBME. Let's come into breast pain. All right, so breast pain can be either bilateral or it can be unilateral. Now, if it's bilateral, it's kind of chill. Okay, if it's cyclic bilateral, we're thinking about just your menstruation abnormalities. Of course, as we know, menstruation, we're getting hormonal fluctuation. Now, if it's not with the menstruation in bilateral breast, then we are thinking of some abnormality. So we may want to do ultrasound, we may want to do a mammo over there. And also we want to look if it's a mass. If there is a mass, we want to do imaging. No mass, we don't do any imaging. Okay, now let's just imagine if it's unilateral. So unilateral is very dangerous. We want to do imaging, and if we see something wrong with imaging, then if there's a mass or no mass. If there's mass, just go directly for biopsy and refer to a breast surgeon. If there's no mass, do imaging. If there's abnormalities like a complex cyst, then we can go into biopsy and observe. I got a lot of questions over here. Fibroadenoma in adolescents with suspected fibroadenoma, we give them reassurance and we re-examine after the next menstrual cycle. Fibroadenomos, they will of course fluctuate with the menstrual cycle. Okay, then we can see over here, patient with fibroadenoma takes OCP for a week. OCP for placebo. What is likely to be seen? Mass is less tender during her placebo pill week. Yeah. So again, this is fluctuating with the cycles of each OCP, so we can see it is a fibroadenoma. Fibroadenoma is going to be estrogen sensitive, therefore can cause focal breast tenderness when estrogen is high. So that's going to be before menses. When combined with oral contraceptive pills, however, breast tenderness typically decreases with low estrogen or occurs with estrogen withdrawal during the placebo and combination of combined oral contraceptive pills. We can even come over here and look at quickly over here at the cycle, menstrual cycle. So of course the first is the follicular. Once the follicles are made, we go into luteinization. We release that egg, and that's going to be here. We also have the first estrogen increase, and then it's going to be progesterone, because progesterone really maintains that lining. So as we can see over here, estrogen is quite high, especially at the luteal phase, when we're releasing that egg, when we're releasing that when we're making that luteal cyst or corpus luteum. Okay, now let's come back over here. We have another question. This is a CMS question. So a 45-year-old female comes to 1 centimeter density in the upper quadrant in the left breast, mammography. Then ultrasound shows a 1 centimeter hyperechoic mass in the upper outer quadrant of the left breast. So we said 45-year-old female, directly we're going to mammo. We're not even thinking ultrasound, and she has a mass. So we're thinking about biopsy. Mass, we're just going directly to biopsy. So we can go ultracorneal biopsy, and that's going to be mass. So you guys know the deal over here. So if it's young, go ultrasound, old, go mammo. If there is a mass, make sure to go biopsy. If there's no mass, do imaging. If there's some problem with imaging, go look for biopsies. And of course, if it's bilateral, we can be a little bit more chill about this. So hopefully you guys found this useful. Thank you guys for watching. Hope to see you guys next time.